While some schools across the nation prepare to switch to remote learning or cancel classes altogether, an associate professor at Harvard, T.H. Chan School of Public Health, argues the schools must remain open despite the rise in cases.
Dr. Joseph Allen joins us now to explain. Good morning.
Good morning, Robin. Good morning, Dan.
We appreciate you joining us. Well, you wrote in a New York Times editorial that closing schools would be a tragic mistake. That's pretty strong language.
Well, the schools should not close. Let's be very clear that the risk to kids from infection, from severe outcomes is low, but the cost of having kids out of school is extremely high. On that first point, the hospitalization rate for kids has stated about 1 in 100,000, and that has been consistent across every wave. It's also consistent what we're seeing from Omicron in South Africa, Europe, and even in the US. On the other hand, well, let me say this. If you don't believe me, you should believe the National Academy of Pediatrics, which said this just 2 months ago. Just 2 weeks ago, the available data indicate COVID-19 associated hospitalization and death is uncommon in children. The risks, on the other hand, of being out of school are severe. We've seen losses in reading and math scores by 4 to 5 months when schools were closed. And that's for kids who were in school. We've seen millions of kids lost from the system entirely. We've seen higher reports of abuse and neglect that were not getting accounted for, even when schools closed for a short time. New York City found 8,000 reports of abuse and neglect that failed to be recorded that were expected. They extrapolate this to the country, and it's 300,000. We see 14 million kids who did not get the food they needed when schools were closed. We see impacts on working women where the labor difference in men and women grew an extra 5%. So the costs are severe when kids are out of school, and the risk to kids from this virus, we have to acknowledge, for 2 years has been very consistent. It is low against severe hospitalization and death.
Well, anyone with kids, I'm sure, can relate to the fact that having them at home has not been ideal. I think a lot of people might say, if the kids aren't at risk, what about the teachers and the other staff at the schools? Aren't they in danger when there's so many bodies in those buildings?
So a couple things here. The vaccine is very safe and effective, and the adults have had access to this for at least 8 months. Everyone should be vaccinated. People should be boosted at this point. People should get their kids vaccinated. These vaccines are safe and highly effective. I support vaccine mandates in school for adults. Los Angeles did this, got it up to 99% vaccination rates. New York City did this, moved it from 70% vaccination rates up to 95% vaccinated. Also, we have to improve ventilation and filtration. If these things haven't been done at this point, with millions and millions of dollars of stimulus already available for over a year and a half, and the vaccine available to all adults, that's a failure of leadership, right? Everyone should be vaccinated in these schools. Parents should get their kids vaccinated. We need to keep kids in schools. The harms are real. We've seen them accumulate, and they're growing, and they can lead to years, if not decades, of harms to these kids.
What do you think the long-term effect is going to be? I'm always curious, you know, if you say they've lost 5 months of learning, do you think 5 years from now we're really going to see the effect in kids' education?
Well, there's no question we're going to see long-term effects. We've seen this when schools close for short periods of time, and we've never had an experiment like this. And quite honestly, it's been an experiment. Kids should have been in school. We know how to keep people safe in school. Let's start there. We know how to keep adults safe. We know how to keep kids safe. That was before the vaccine. We now have a highly effective vaccine that is available. And it's not too late if you're not vaccinated or boosted. So if you get that vaccine now, you have excellent protection very quickly. Not full protection, but you do get protection quite quickly, on the order of 10 to 12 days. If you're vaccinated and you're not sure if you should get the booster, you should. And that benefit kicks in on the order of a couple days. So you can still get that vaccine and booster this week and have good protection heading into January, because let's be clear, cases are rising. Cases are going to continue to rise because of Omicron. But fortunately, we have to pay attention to the 2 key risk factors: age and vaccination status. So kids are low risk for severe disease, hospitalizations, and death, and adults have the tools to protect themselves. On top of that, anyone who wants to wear a mask should wear a high-grade mask. If you're vaccinated, boosted, and wearing an N95 mask, that's about as low risk as anything you can get in life.
All right, well, you can read the full op-ed on NewYorkTimes.com. You can also follow Dr. Allen on social media, or check out schools.forhealth.org. There's a website there. Dr. Allen, thanks for your time this morning.
Thanks for having me on. I really appreciate it.